Hi, I'm Dr. Julie Steinauer. I want to do a video to show you two cases that we have worked on, one recent, one in the past, and that we had great success with two different patients, helping them to achieve alignment of their eyes and get rid of their strabismus. Now, before I go into that, I want to tell you how you can connect with us. If you're local, call us at 618-288 1489. If you're not local, go to our website at visionforlifeworks.com. You've got two options. You can either schedule a consultation directly with me, or you can fill out this questionnaire and get some feedback on your vision. Now, let's talk about our two patients, one recent, one several years ago, both of whom have given their permission for us to share their photos and talk a little bit about their cases. So the first one I'm going to start off with is a patient of ours that we had a couple of years ago. And this little guy, he has an esotropia, or an eye turning in. And he was fairly young when he started working with us, but we used a combination of Syntonics, which you know I talk about a lot. In fact, let's just show you that filter that works for esotropia, if I can manage to do it with one hand. Oh, I'm trying really hard. Okay, here we go. Are you ready? Grassy green. Ah. Okay, so that helps in esotropia. It triggers the brain to send a signal to the muscles to help line the eyes up. So you can start to see that this little guy started to get better alignment of his eyes, and he still to this day has awesome alignment of his eyes, normal binocularity, and normal depth perception, which is pretty amazing. Now, let me share with you a different case. This is a case of exotropia, where the eye turns out. Again, these people have graciously given us permission to utilize these pictures and tell just a little bit about their stories, not giving away too much detail. But this gentleman has an exotropia. You can tell that this eye is turning out. In this picture, you can also see that this eye is turning out. Let's show you the filter that works to electrically trigger the muscles. And this one is a little harder to see. Let's see if I can get it just right. You can kind of see part of my office there. Okay, I'm having a tough time. Hold on. Let's see if we can get it. Oh, there it is, just a little bit. It's actually kind of a darker green. That one's tricky to show you. It's a little bit of a darker green that they wear looking at a light source to electrically trigger the muscles of the eyes to not let them turn out, but to pull them more straight. And let's just see what happened after 4 months of therapy. Here he is before 4 months of therapy. Here he is with aligned eyes. Now, this is a non-surgical treatment, and what it does is it just, again, electrically triggers the brain to signal the muscles on what they need to do, and then we come alongside with what would kind of be like a physical therapy and occupational therapy for the eyes and brain, training the brain how to continue to keep the eyes aligned, to be binocular, which means use both eyes at the same time, and to have normalized depth perception, or what we call stereopsis. If you're thinking, oh my gosh, you showed me a picture of a kid and you showed me a picture of an adult. Does this work on everybody? The answer is yes, it does. We work with infants all the way up into the elderly population. There's no age range that this is not successful with. There are some parameters there, though, that can make it successful or not. And if you're very interested in it, then we're going to tell you how you can connect with us. We'll consult with you and talk to you about whether or not you're going to be a good candidate for this program. But we've had tremendous success. I've been doing this for 21 years now. 21 years. A moment and a pause. That's a while. Okay, I'm over it. 21 years, we've had really great success with helping our patients learn to align their eyes and become non-strabismic. And that means that it's possible. It can happen for you too. So if you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. You can either do one of two things there: schedule a consultation directly with me if you're not local, or you can fill out a questionnaire and get some information and feedback about your vision. Now, if you haven't done so already, please like and subscribe to this channel so that you can get all notifications. Make sure you hit the all bell notification so that you get all those things, every video that we put out. And if you feel like this could be beneficial to someone else, maybe you're not the one or your child's not the one with strabismus that could be helped, but maybe someone that you know is, please pass the video along. Thank you.